Hello, and welcome to The Mind of a Therapist, a podcast where I interview psychotherapists and helping professionals and what they're passionate about in order to provide you with messages of encouragement and hope. I'm your host, Andrew Earle. The Mind of a Therapist is sponsored by Psychological Counseling Services, healing hearts and transforming lives. Look into our intensive at pcsearle.com. In today's interview, I interviewed Dr. Adrian Fletcher and her husband, Tom. Dr. Fletcher is a psychologist and trafficking survivor with lived experience of dissociative identity disorder, DID for short. She is also a speaker, consultant, author of One Soul, Multiple Expressions, Poems by the Parts, and host of the mental health podcast Braving the Way with Dr. Fletch. She has been working within the field of mental health for close to 2 decades and has recently turned her focus to the community at large. A passionate mental health warrior, she is looking to change the perception around mental health related conditions and is standing up to stigma. She wants to inspire individuals in the community at large to become trauma informed and to lovingly accept all parts of themselves, regardless of a mental health condition. Before I play the interview here, I want to give a bit of a trigger warning. Dr. Fletcher talks a bit about her trauma history, and if you have a trauma history, I just want to encourage you to proceed with caution, perhaps take inventory of what's going on internally for you and whether it makes sense for you to listen to this episode. And one last piece, I'd encourage you to go to Dr. Fletcher's podcast, Braving the Way. I'll link it in the show notes, and listen to a few of her episodes where she does monologues, and or listen to the episode I previously did with Dr. Fletcher, where you could get more of a sense of the lived experience of someone with DID. I think that you'll gain more from this conversation if you start there, but all that to say, if you just listen to this, you'll gain a lot as well. All right, Dr. Fletcher and Tom, thanks so much for being on the podcast today. To get going, I didn't ask you this on the first interview I had with you, Dr. Fletcher. It's been a new question I've been asking the guests at the onset of the episode is, how do you two view change? What does it take to change individually? What does it take for systems, relational systems, or other systems to change? How do you two understand change?
Yeah, that's a loaded question. Do you want to go first? Do you want me to go? Well, first, I just want to circle back. So the very first time I was on your podcast, we were talking about DID from the perspective of a provider. And it was shortly after that interview that I realized how important it was for me to come forward with my lived experience of DID, because after that interview, I actually didn't feel well, not because you did anything wrong, but because at the time I just wasn't out and open about my experience. And I thought, that was also part of what prompted my authenticity and vulnerability to come forward. So I just wanted to go back about that. In terms of change, change with anything, behavior, relationship, or wellness, it's really about a commitment and a willingness to sit in uncertainty, because change is inevitable regardless of what we're going through. And I think especially in a relationship, it takes dedication and devotion, and a commitment to ride the waves together. And, we haven't, always been perfect at that. I don't know that we'll ever be perfect at it, but we certainly have both learned how to navigate a lot of different changes in our own lives, because we both, came from, different types of backgrounds where we experienced some loss early on. And so we've had to learn how to adapt to change rather early in our life. So that would be my perspective on change.
Yeah. How about you, Tom?
I view change as basically the incremental differences that you make every single day. And those can be differences that you're making in other people's lives or in your own life. If you look at our journey, a lot of our journey has been making subtle changes every single day to make sure that we're improving our communication, improving ourselves. And a lot of that has to be knowing that there's a greater outcome.
Yeah, so knowing there'll be this greater outcome serves as the impetus to make these these subtle shifts that need to happen and inevitably do happen. Like you were saying, Adrian, all relationships, the one thing that's consistent in life is the inconsistent is change. Change will always be happening. So yeah, thanks for that, you two. And I wanted to track back to what you're saying, Adrian. Since we had that initial podcast, you've been public about your experiences with DID. You've started a podcast. It's called Braving the Way. Is that right?
Yes, Braving the Way with Dr. Fletch. Yeah.
Braving the Way with Dr. Fletch. I've listened to a few episodes. Highly recommend it. I found myself very hopeful with the messages you shared, very inspired. A lot of what you shared really resonated with me. Your mission's so clear and so evident with just the authenticity, and it's really powerful. Curious to hear about what that experience has been like for you, sharing such an intimate part of your experience with the public.
Yeah, I didn't expect to be so moved with emotion. It really has been quite the roller coaster, both liberating, freeing, and scary. As you know, mental health related conditions are not talked about openly, and they need to be. And in addition to that, having DID, living with a very highly stigmatized, misunderstood, quote unquote, mental illness, which I consider mental greatness. It has, there have been some beautiful blessings with coming forward, and then also just some uncertainty, but I trust the process, and I know that I'm helping a lot of people. And I certainly would not have been able to arrive at a place of wellness without Tom. And I actually wouldn't be on this planet at all without Tom. I credit him for saving my life and for fighting for my life when I was too unwell to do it on my own. And to have his devotion and support as I step into uncharted waters with being so public and open, that means everything to me.
Yeah, absolutely.
Mm-hmm.
What's that like for you to hear, Tom?
Yeah, it's very very surreal, I guess, because obviously when I first met my wife, none of this was at the forefront. It wasn't anything that we were even thinking about. And then all of a sudden there's almost this diagnosis, if you will, and it's akin to my experience growing up, where my mother was diagnosed with cancer a couple of different times. With my mother, it was more of a physical ailment. With my wife, it's more of a mental ailment. And so it's difficult watching the struggles that both of them had to go through. With my mother, it was more of a decline in life, and with my wife, it's more of a incline in life. So you're seeing this great movement in what she's capable of doing with the knowledge that she continues to gain about her past life and what has happened to her and how it transpired. And so it's very very interesting to see how individuals are responding to her. And the vast majority of the responses so far have always been very positive, very heartfelt. And so it's great to see that she's able to make connections to individuals and complete strangers, knowing that those strangers have in some way have experienced something similar or have similar feelings and thoughts. And basically by her being able to go out there and openly communicate in a very intellectual and educational way is very, very helpful for a lot of individuals and very inspiring for myself.
Wow. Well, when you were talking there about with your wife, it's this incline. I had some tears come to my eyes. That was just very touching, and you sharing age, it is such an inspiration because we all have mental health struggles. I was just listening to a podcast. You were saying we all have mental health, mental health issues, just as we have physical health. And for whatever reason, mental health has been stigmatized. We don't talk about it often. And so how courageous it is. Your podcast has the perfect title, Braving the Way, because the act of you being honest about your experiences is so courageous and brave. I wonder if we could talk about where you two met, when you met each other, your origin story, and when you two knew this is the person I want to spend my life with.
Yeah, you usually tell that story better than I do. Do you want to tell it?
Sure. So I moved out to Phoenix, Arizona from Ohio in early 2007. And then about 6 months later, uh, Adrian moved into the same apartment complex across the hall from me. Supposedly, she introduced herself numerous times to me. I don't recall that very much, but then the one time I do remember it, I got very excited that a good-looking young girl was talking to me, and so um, we actually were supposed to go to an event that was happening at our apartment complex, and we were going to go there with some mutual friends that also lived across the hall from us. Um, and so they still remain in our lives today. So it was a lasting relationship all around for all of us. Ultimately, supposedly she was supposed to knock on my door that night. I never heard the knock. And so I thought, well, she stood me up. So eventually we see each other later. She tells me where she lives and what the apartment complex was. And then I tried asking her out on a date. Ended up asking her about 6 different ways on, would you like to go out on a date with me? That's 6 different times within one night, mind you. So I was persistent,
Yeah.
and I was excited when I got to talk to her, because then she started talking about her previous experiences in life, and going to an Ivy League school, and her wanting to get her doctorate degree. And I was very smitten from the beginning. So it was love at first sight for me, and a probably ongoing battle of trying to prove that I was her boyfriend for probably about a year, I would say.
Ah.
Yeah. hmm Yeah, I mean, he cracks me up when he tells the story, but I did go knock on his apartment door, and I think his music was too loud and he didn't hear me. But I had always sort of described myself as a difficult person, and one that I didn't think people should get connected to. So when we first started dating, I kind of would let him know, like, listen, like, I'm kind of a difficult person. It's like I knew I had pretty significant attachment struggles, but didn't have the language for it. So there was a lot of like, I really adored him and wanted to be with him, but would come up with all kinds of reason as to why I couldn't fully commit. I was going to go to school. I was going to have to move away for internship. I was a difficult personality, assertive, bold, strong headed, and that he should probably not get involved with that. But he really hung in there. And the first couple of years of our relationship were really rough. Now, when we look back, we're like, oh my God, this makes so much sense. There was a part coming out here and another part here, and really trying to push him away, and really quite mean. Like it's really hard as a person living with DID, to take full accountability for all parts, because for so long I was so fragmented. I didn't have the awareness of some of the behavior that I was doing, but I was not a nice person in relationships, because it's like the closer people got to me, the more the parts got scared. So I say we as representing, all of my DID system, were not very nice to him at times. And God bless him for hanging in there and for learning his own boundaries and his own assertiveness with me. I mean, I think our relationship is the best it has ever been right now, but those first initial years were really, really tough. And if I look back, and if I would have known, I would have done things a lot differently, but I didn't know. And so I've had to really work through some self-forgiveness around how I've treated him in the marriage that was not kind and not appropriate towards him. And that hasn't been easy, but I did need to ultimately get to a place of self-forgiveness so that I could move on in my marriage and try to be, I don't really like the terms like best and greatest, but I really do try to be, a really loving, attuned wife today, to the best of my ability. I'm certainly not perfect. But yeah, the earlier years were rocky. We also had a lot of fun in the early years. We did a lot of activities together, sports. Tom is pretty adventurous. So, he introduced me to nature and hiking and really to things that were really good for my soul. Versus some of the things that I was wrapped up in before, before I met him. So again, just really grateful and blessed that he's hung in there, because I don't know that most people would have. I really don't.
Yeah. So I'm hearing these parts of your system, Adrian, were pushing him away as he was getting closer, because they were scared of
Right.
that closeness. And Tom, I'm curious, what kept you persisting amidst the pushback? I was hearing you were quite smitten by your wife, but what was it that kept you going?
That's a solid question. I think it was a lot of naivety on my part of not knowing what perhaps a healthy relationship was supposed to look like, and then what an unhealthy relationship was supposed to look like. A lot of I probably perceived what she would classify as anger towards me more as playful interaction, and that might just be because of again my own naivety. But like, if we would wrestle around, I thought it was fun wrestling, and perhaps she didn't think it was fun wrestling. She
Yeah,
thought it was scary wrestling.
Dr. Fletcher shaking her head back and forth as you're saying that.
Yeah, I mean, to me, that was terrifying, right? Like some couples do that. They like play around and wrestle each other, and that would throw my entire body into a full fight or flight response because, unfortunately, whether people are able to sit with the darkness or not, I was held down as a child and tied up, and horrible things were done to me. So any human being touching me, a hug, even sometimes I would avoid shaking hands, but just wrestling, playfully as a couple. Tom saw a side of me I think, probably never wants to witness again. And again, at the time, going back, we did not know, what was going on in my psyche. And I didn't have the awareness of all my abuse at the time.
Yeah, and a lot of it was I would try to raise a lot of um, points of observation to her, and it would always be like this sincereness to her that you would be able to see, and so you would know that there was probably some previous issues there. um I think as the relationship continued to evolve, it became pretty clear to me that there was a lot more under the surface that just we didn't know about. And so when things started to kind of keep coming out, it was more like, well, yeah, I knew that already. And here's some data observations, or do you remember when X, Y, and Z happened? But every time there was always this kind of hostile moment, perhaps. And I think the most embarrassing ones were when we would get into a fight in public, because ultimately at the time it wasn't Adrian that I was speaking to, it was another part that was out and open. And I remember getting glances across the room from other individuals and how almost shaming it was because I was being shamed for some reason because of whatever part was out was wanting to voice their concerns in that fashion. And so it was very difficult at times to want to continue to handle that, but it was really kind of setting boundaries even at that really early stage, like, hey, that was embarrassing for me. I didn't like that. And I might not have gotten the response that I wanted at the time, but you could see that there was an impact on being able to voice my concerns and frustrations. And so again, that kind of all boils back to the fact that at the very heart of Adrian is a very sincere person that's very happy and very excited about life. And so that's probably what really kind of kept me going, is knowing that somewhere in there is this person that I really enjoy spending my time to. There's definitely some frustrations that come out at times. That's probably a lot of the part on my behalf, because I'm sure I was very immature early on in my life, and probably even today I could probably point to a number of cases to say,
As we all are, Tom. You're not alone in that. And yeah, I'm curious. Thanks for sharing those pieces, Tom. And I'm curious, Adrian, what it was like for you as Tom started holding those boundaries and really expressing, ouch, that was hurtful, that was embarrassing, when these parts of you were showing up because you weren't aware of that experience at this point. I take it, right?
Correct. Yeah. So over time, parts are always listening to stuff, even before I was aware of all of my parts, right? And we're still getting to know certain parts. And, with the coming out process and the coming forward, there are some parts I'm getting to know that I wasn't really aware of before. And, it's just one of those things that, I've learned to get used to. But when Tom started, having his own boundaries and being really assertive about how he felt, it did help the parts that struggled with understanding attachment and empathy really start, he earned a level of respect with them when he would respond in a grounded, healthy way. Now, I can't say that it was like really smooth, like, oh, okay, we get it now. It was more like they heard it. They may have still responded the old way, but have learned over time to respond to him differently. Now, we did have a remarkable couples therapist that really helped us save our own marriage. I mean, if we're really honest, we needed her guidance. And, she would help Tom understand where he shouldn't push and shouldn't, kind of be what we call a hammer, just like kind of trying to throw a bunch of solutions at me, let me and the parts come to him to ask for help, and really helped us not kind of parent each other. Because you can imagine, as a person living with multiple parts, and I have multiple ages in there, young ones, teenage ones, there were times like Tom sort of had to be the more adult in the relationship. And she really helped us balance that out. And she helped me be the best parent I could, my parts, and for Tom to be the best parent to his inner child. And that way we're not parenting each other, and we can learn how to communicate our needs. And then I can check in with the parts. And if they have a need, I can communicate that to Tom, but there can't be an expectation for Tom to meet the parts needs, right? There's a difference between needs in a marriage versus parts needs. And a lot of the time the needs that need to be met on behalf of the parts are my responsibility. And so, I mean, this has taken a long time in my own healing journey. We're looking at 10 plus years of healing. And thank God we had a remarkable couples therapist that helped us navigate a lot of these difficulties that we just weren't, we just didn't have the language or a way to learn how to do it differently. But Tom has earned a very significant level of respect and trust with all parts. And I think, and I don't know, you can speak to this, but I think, those episodes are so far in between now as compared to before. It was like fireworks all the time. I mean, it was just a constant emotional drain and dysregulation, very difficult on both of us.
Yeah. And you mentioned when Tom would be come from this calm, more collected state, it started to build trust amongst those various parts of yourself. I'm curious, Tom, as you started when was it that you started to notice that these parts were showing up, and what did that process look like for you?
ooh, It's probably difficult to kind of point out exactly when I started to know that there were different parts to Adrian. I think very early on, you could tell that there were definitely different characters to Adrian. And that's kind of how I always kind of thought of her, is that she had a lot of different characters, or she has a lot of character to her. And I'm sure there's a lot of individuals out there with DID that get classified in that fashion. Oh, that person over there is very characteristic, or there's great characteristics, and there's many characteristics to them, a lot of depth to the character. And that's really kind of how I kept kind of classifying her and describing her, is that there was just a lot of depth to her. If I knew that she was drinking, and alcohol was definitely something that added a lot of fuel to the fire early on in our career, or not career, but lives. And basically, it was very volatile when alcohol got involved. And that's probably when I started to realize that there's a different part. How do I act differently around her when she's drinking? Um, and really, what it came down to was that we just both realized that if we were going to drink, we had to drink in moderation. And eventually, we got to the point where we realized that alcohol in general is not doing anything beneficial to us. And so we might still have a celebratory drink every so often, but having two drinks in a night is extremely rare. And that's been the case for the past couple years now. And that's really been what has allowed Adrian to really start to um, really connect with herself. And then that's really when you started to realize that there were, in fact, different parts to Adrian, because the alcohol wasn't there and it wasn't subsiding everything.
Yeah, as you're talking there, Tom, and as you were talking earlier, this image of you two kind of as a team. You use we a lot, and I see you two kind of as a team, looking at your relationship, seeking help with a couples therapist. I've talked on the podcast before. My wife and I have done couple therapy. My dad and my mom, my grandpa and my grandma, we've all talked about it. It's so important for couple, and the earlier the better, where you can seek help and, nip issues in the bud and really learn how to be there for your partner. But I've just seeing you two kind of coming together, looking at your histories and the relationship, and supporting each other and figuring out what's gonna work as you're continuing to move through life together.
Yeah, so important. And, it wasn't always so easy for us to lean in and surrender to that help. I mean, I'm going to be honest, there are times we kind of probably both threw each other an ultimatum here and there, but ultimately, you refer to us as a team. We kind of say we're like team A and T. I mean, we just are. We're completely devoted, and we work through the hard stuff. And the couples therapist that I'm referring to, who I've also done some individual work with, again, saved my life, saved my marriage, really has helped Tom. And she said, so with the alcohol use, after my mother died, I was drinking way more than I had ever probably had in my life. And she said, Adrian, the marriage really doesn't start to become unsteady until you throw alcohol in there. And it was at that moment that her and I worked together, and I ended up taking a year hiatus from alcohol. And I started with, a day, and then it was 2 days, then it was 5 days, and then 30 days. And I went to Celebrate Recovery, and I went to AA meetings, despite the fact that I thought that was the last place I'd ever want to go, because both of my parents were alcoholics. My father's so severe, he died of cirrhosis of the liver. And my mom of pancreatic cancer. And although they can't tell me the exact reason why she got pancreatic cancer, she was a nicotine smoker for 50 years and an alcoholic. And that's still debatable whether or not she was a full-blown alcoholic in my family. But to me, she was. I witnessed it. Tom has witnessed it. And, I was at risk to becoming a full-blown alcoholic. And what's interesting about DID is I really only have a part that probably has a propensity to be a full-blown alcoholic. And I work with that part on boundaries. And like Tom is saying, we have a lot of boundaries around alcohol because, like he said, it might be a celebratory drink with a safe person, a safe friend, or with Tom. And we have rules and limits around that so that, we can keep ourselves healthy and the relationship healthy. But yeah, I mean, that was a big turning point for me to really address my relationship with alcohol and to help that particular part that struggled with it the most to have a different outlet and a coping skill. And the 12-step groups were a great avenue for that part. And I'm blessed that that part was willing to go engage in that type of help, because most people, won't choose to do that.
Yeah. And will you say more about what it looked like for you to um, support that part in setting those boundaries with alcohol and yeah, going to AA
Yeah.
meetings, etc.?
Yeah, it's kind of like, they say when you're dealing with any type of addiction, right? You want to change people, places, and things. And I had to step away from some people that I do love with my whole heart. But if they were engaging in drinking, I just knew that it wouldn't be safe for me, not because they're forcing me to do anything, but because I knew if I put that part in that particular situation, that it wasn't going to end well for anybody. And so I had to change who I hung around with during that time. I actually think I was pretty isolative at that time. Probably would talk to Tom and our therapist a lot about it. And I would go to the meetings by myself. And I pulled away a lot from a lot of friends. It's like I had to change my whole world and way of showing up in order for me to get sober. And I was, so lucky that my therapist was willing to sort of be the sponsor, because I didn't trust. I couldn't just go to a meeting and like trust a new person. It's so hard for me to trust anybody that she was sort of played two roles for me. She played sponsor, couples therapist, and some individual support. And I know that's going to challenge and step on some traditional therapist toes, but God bless her, I needed her to do that, and it saved my life. So yeah, that's what I mean. And just having to also, whenever we take something away, we have to replace it with something. So the meetings were helpful, but then getting back into doing some art, spending more time in nature, being open with Tom about where I was going, who I was spending time with, and then telling friends like, hey, like, I need some accountability if I'm going to go to this event. Like, I really don't want to drink. I can't drink, that type of thing.
I'm hearing it was a big shit. Like there's big losses there in
Yeah.
not spending time with certain people that you used to spend time with, but yeah, choosing to do that ultimately for your health. And then I'm hearing at some point though there was there was like almost isolation from people for a period, but then I'm hearing also that you start reaching out to Tom, you lean on your therapist, you start talking to friends about these boundaries that you're starting to hold for yourself. And was there like a point where there was a shift there?
Yeah. Do you want to say anything about that?
Yeah, definitely. Definitely a shift. And it was probably about 3 months of being alcohol free, because I think by that time it was a complete detox from her body of all the ramifications. I know if I have, for myself personally, if I have an alcoholic beverage, I know I'm going to have elevated OCD symptoms for the next 3 days, with the third day being the worst out of all of them. And so that's a decision that I always have to make. Like, is this drink that I'm about to have worth the the pain that I'm going to have to go through in order to have 30 minutes, maybe 60 minutes of enjoyment? And so it's really not worth it. And about 3 months in, you could definitely see that difference in her. For one, physically, she looked different. Um, and then at that point, it started to really kind of stabilize for her. Her life started to kind of stabilize. And we ended up a while ago basically drawing out on a piece of paper. I was explaining what I was experiencing and viewing with her. And what I was thinking was happening. And basically, the first stage was stability. And she didn't really get stability in her life, severe stability, until her father passed away. The next time she probably got a little stability in her life was when she met me. I'm sure there was other moments in between where there was still stability, but uh, the third time that she really had stability was really with the death of her mother. And so when that happened, um, obviously there was a lot of chaos at the very beginning. And it wasn't until she was challenged to take alcohol out that she really started seeing stability in her life for the first real time.
That's all true. I would say out of everything in my life, Tom has probably created the most amount of stability for me. The hard part about giving up the alcohol, though, is when I started to get flooded with all of the abuse from childhood. So once the alcohol was removed, it all came flooding back. And then we were dealing with a whole new rodeo. And this time it was, really intense PTSD symptoms, which I had already had, but they were, I like to say, like, maximize times 1,000, and stuff was coming into my mind I couldn't even believe was actually possible. And parts started to show up and talk with Tom and share with Tom, sometimes without my awareness at all. And I would sort of ask him about what parts had reported. And, Tom has a very genius brain. He falls on the spectrum of, um, you know, like high functioning Asperger's essentially. And he's a data collector. And he collected data on all of my parts and could report back to me what they were doing and saying. And honestly, I don't know that I would have come as far as I have in my healing without that, because I wouldn't have been present enough to have all of that data. And then the hard part, of course, for him as being my loving spouse is, to hear trauma and abuse and the things that have happened to the parts did ultimately end up taking a toll on him. So this has been a really long road. We're talking, a lifelong history of trauma, his family of origin and his mom's illness, the death of both my parents, alcohol and chaos, and my dedication to my career and school, because I'm, been an academic and a workaholic. And, all of that is shifting now. And I'm finally showing up for me in all parts. And Tom comes first. And I've said I'm in a variety of different groups and things like that, like women's groups or empowerment things or mental health. And I've said from day one that with me coming forward, the minute this takes a negative impact on my marriage, then I will no longer continue to do this work, because I have worked too hard in my life and in my healing to get to this place of stability and have a loving husband, that if anything gets in that way, I can choose to step out or tap out, as they say in the UFC, because I don't have to do this work. I do it because it's my soul's purpose and my journey. But the minute it takes a negative impact on my health or on my husband, then there will be no more of me doing what I'm doing. And it has to be that way. That has to be the boundary, that I have.
Yeah. Well, I love that, and it makes me think of Marilyn Murray's Circles of Intimacy, and how you have yourself in your higher power, from what I've heard you say, in the center there, and then comes Tom, then comes these other professional community circles, and your behaviors with what you're saying is that those are the priorities. So the moment that one of those outer relationships or spheres impacts one of the closer ones, you really have to look at that.
Yeah. Yes. Yep. Absolutely.
Yeah.
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 Did you have something to say? No.
Well, I'm curious to hear, you two have so much experience as teammates, supporting and loving each other through, both of your family of origin experiences and experiences of pain coming up in our relationships, as we all do. I'm curious for people who, maybe couples who are listening, and maybe couples particularly where one partner has a trauma background, maybe has DID, PTSD. What message do you have for that couple?
You want to go first? For me, it's really about a willingness to take accountability, which let me just fully be transparent and clear because I have multiple parts. For a long time, there was like limited accountability, and for some of them, none, which is very hurtful to a partner and absolutely not okay. I really think it's about taking accountability, a willingness to learn your own boundaries and stay in your own lane. Respect your partner. You're both going to have different thoughts, attitudes, feelings, behaviors, friends, likes, dislikes. Not to fix or rescue one another, but to show up alongside each other with support and to share open and honestly how you feel with your partner. And not expect the other one to fix it. You know, Tom has done a really great job, especially in these last couple of years. He's right there if I need something, but he really encourages me and the parts to figure out what we need to figure out for ourselves. And then, you know, when the adult needs to come to the table to meet him where he's at, that's what we do. But a willingness to just not point the finger and do the blame game, because I think we're both equally guilty of the back and forth pointing of the finger, and that didn't get us anywhere. It just made us more disconnected, more angry with each other. So yeah, I would just say accountability, boundaries, and support, not rescuing and fixing, and get help. I mean, that's the thing about it. Somebody asked me my most number one health tip a couple of weeks ago, and I said asking for help in any area of your life. Asking for help can go so far, and sometimes you might meet a couples therapist or another therapist, and they're not the right match. Try again, and if it's not therapy, it could be some other type of, you know, seminar or coach or, you know, something like that. But there's help out there for just about anything. So I think it's just important that people know, in order to change things in any relationship or for yourself, you got to be willing to surrender and ask for some help.
Well, if the listeners could see me, they would see I was bobbing my head back and forth, nodding in agreement there. It's no matter how hard, you know, things are in our relationships, in our inner world, it is keep going and find what works for you. Yeah, therapy can be a very helpful tool if you get connected with the right therapist, but it doesn't have to be the method of healing. There's plenty other forms of healing that people can pursue, and finding what works for you is and resonates for you is so key. And then, yeah, definitely hear you there with the accountability piece, and you were talking the finger pointing. My wife and I engage in that quite a bit too. So that accountability is big, looking inward, and then where you're saying Tom has done a good job with avoiding that fixing posture. I think we're all guilty of that in our society, because we're taught it from a young age, and it's we see a person in pain, we want to fix it, but often what that person needs is just to be listened to.
Yeah.
So yeah.
Yeah.
What would you say, Tom?
Yeah. So the funny thing is, in my career, in my professional life, I effectively fix systems. That's the best way.
Wow. So that was really hard then.
Fix and integrate systems. So it's funny because now I have in my my personal life now, in my marriage life, a job of trying to fix and integrate systems. Now, obviously, I can't fix the systems, but maybe improve the systems is the best way of thinking about that. And really, when it comes to either integrating a system or improving a system, it's really boils down to three key categories, which is that you have boundaries, you have policies, and you have procedures. And that really plays well in your marriage to have a successful marriage. And as you said, Andrew, you can have a number of different tools at your disposal, and psychology and therapy is definitely one of them. Meditation and yoga, another example. And so it's really kind of, as a couple, defining what your boundaries are, what is tolerable and what's not tolerable. What we found out is alcohol wasn't tolerable for both of us. So that's a boundary. That boundary eventually turned into a policy where, as Adrian said earlier, we have these little rules. So, like, tuber gotta Uber. So if you have more than 2 beers, you gotta Uber.
That's good. I like it.
So it really put a limit on, do we want this third drink? No, now we have to Uber. I don't want to pay $60 for an Uber. So it's a good policy. And so then we have procedures as well. So when things become difficult, when she's having a hard time, we have key phrases that we use to stop the other individual from acting a certain way or behaving a certain way. And if I feel overwhelmed, I'll actually go and do my own thing, and then I'll separate myself, and I will let her know that it's not necessarily abandonment, but rather that I'm taking care of myself. And so it's really been the development of those boundaries, the policies that we want to create for our relationship, and the procedures that we're going to do to take care of ourselves first and foremost.
Mhm. And we joke that, you know, he really is like the world renowned psychologist. He just doesn't have the doctoral degree in psychology. Like, he's brilliant. And like he was talking about systems and obtaining data and then looking at it in a more efficient way to process something. And you know, I kind of joke that he's logic and I'm emotion, and together we make wise mind, which stems from DBT, right? When we're in flow, team A and T, you know, pretty much conquers the world. I mean, we're great at what we do. We are very successful in our careers. We're super loving. We have wonderful friends we like to hang around with. And when we're not in flow, it's like, woo, we got our, you know, the wheels are coming off, but we always figure out a way to put them back on. Thank God.
Yeah, absolutely. And I think I've been gifted that experience of you two as a team and flow in this conversation, and our listeners get to benefit from that as well. And yeah, Tom, what you're saying there about the boundary, how important it is for us to talk regularly, ongoing, as these boundaries shift and change for ourselves, and then with our partners, what are our relational boundaries? You know, there's so much rich conversation that needs to regularly be visited there, and I think that that's so powerful. Yeah, Adrian, you mentioned that you had a poem that you wanted to read. You be willing to do
Sure.
that now?
Yeah.
Is this a good time?
Yeah. I mean, Tom, you know, is obviously the person in this world that I love more than anyone. But yeah, the parts had been writing poetry throughout the recovery journey. And recently we self published our poetry book. And so there's a little short one called Warmth, and it's about love, and it's about love for Tom. So it's called Warmth. Love is warm, gentle, inviting, calm, and cosmic. And that is how all parts of me feel with Tom. And it took a long time for all parts to really allow love in from Tom, and for me to be able to express, you know, that love back to him from all parts. I mean, there were times he would be able to express love to me, and if a different part was present, they couldn't say it back. And you can imagine how painful that might be for a partner.
Yeah. Notice emotion is coming up as you said that, Adrian.
Yeah, I mean, it's a lot. It's a lot because what people don't realize about living with DID is the amount of pain that it causes other people because of the different parts switching in and out, and you know, the disappearing act, as they call it, like disappearing from friendships because other parts are triggered, or other parts don't have a relationship with this friend but the other parts do. And I have caused, you know, and it's hard for me to say you know, I have caused a lot of people pain, Tom included, as a result of having DID and not having an awareness of parts. And to not be able to say, I love you back because another part was present. That certainly hasn't just happened with Tom, you know, that has happened with, you know, people in my personal life. And it's just been extremely challenging. And unfortunately, I've had to let go of a lot of people that just can't wrap their mind around that and can't understand it, even with all of the knowledge, education, and lived experience I'm putting out into the world. because it's also painful for me. Not only is the attachment stuff caused other people pain, but it's been a heartbreaking experience for me as well.
Mm. Yeah. And thank you so much for sharing all that, Adrian, and for the poem. It's so touching, and I see that warmth in your guys' interaction. This whole conversation, just the listeners aren't able to see, but there's just so many smiles and gazes when the other person's talking, and I just see that fondness and admiration between you two.
Yeah, thank you.
Yeah.
Yes, thank you.
Well, we're getting to the end of the episode here. Before I ask the question I generally finish with, where is a good place to direct people? I know you got a lot going on right now, Dr. Fletcher, and what sort of resources would you direct someone to if they want to learn more about your work?
Sure. Yeah. Well, first, I always love to mention the organization An Infinite Mind. It's an organization out of Florida, international on DID. They have been so great to me and to us. Tom and I will be speaking at their conference this year, coming up here February 17th, 18th, and 19th in Orlando, Florida. But aninfinitemind.org is a great place for people to go to learn more about DID. People can find me. I have a blog on Psychology Today called Keeping It Real and Resilient. I also have an Instagram where I do a lot of reels and education and just my journey through this coming out process. And that's at Dr. A. Fletcher on Instagram. I have my podcast, Braving the Way with Dr. Fletch, available on Spotify, Apple, and Google. And then I have my poetry book, One Soul, Multiple Expressions, Poems by the Parts, available on Amazon.com and BarnesandNoble.com. So that's all that I'm up to right now. Looking forward to my presentation with Tom on boundaries and partnership for the DID conference. And him and I will probably continue to do some workshops, maybe once or twice a year, for other couples living with DID. We've done a few and they've been really wonderful. And we enjoy doing those together. So that's where people can find what I'm up to.
Yeah, and I'll just say, as I mentioned earlier, highly recommend all the content you're putting out there. Every time I read or listen to your content, I learn something new, and I'm more inspired and hopeful at the end. So thanks for that work, because I know as a podcaster, it's work. It's work to sit down, record, schedule. There's a lot of moving parts there, and it's such a service to the community. So thank you.
Yeah, you're welcome. Yeah, a lot of times that people, they kind of always want to know like what your message is, right? And really my message is just to really bring hope, love, and inspiration to the world. I don't have like a very fine-tuned message. I just hope to keep showing up and being authentic, and that alone I think helps and inspires others. So that's what I, intend to do.
Yeah, it absolutely does. And then the question I like to pose at the end of the episode is, what's a message of hope you'd like to leave the listeners with today? You two already have, but maybe it'd be something you've already mentioned that you really want the listener to hold on to, or maybe something new that you're thinking about right now.
Mm-hmm.
Finding stability is really the first step. And if you can find stability in your life, then you're really going to improve and go far.
That's great.
Yeah, and I think not giving up until you find and create that stability, right? For me, yes, I mean, my healing really started to take off a couple of years ago, even though I started to engage in psychotherapy in 2012. I really didn't see the remarkable progress until 2018, when my mother died and I quit drinking alcohol, and my diagnosis was reconfirmed, and I really surrendered and accepted the fact that I have DID, with all of Tom's help, love, and support. I had some other things, like you talked about stability, like my career and my practice and all of that, but it wasn't until I really started engaging in connection with community, some other organizations I'm a part of, like An Infinite Mind, Powerhouse Women, More recently, I completed a program for women called Creatress with a woman out of Scottsdale, Lindsay Smith Campbell. And then now I was just made a member of Badass Do-Gooders, which is a heartfelt driven entrepreneur alongside Annalyn McCord, who's an actress who also lives with DID, and her best friend, Seek Smith, who's head of Mom Army and head of Badass Do-Gooders. And Seek and Annalyn and people like Lindsay Schwartz, head of Powerhouse Women, Jamie Pollock of An Infinite Mind. Like, I emphasize this because for people with PTSD and DID, to lean into connection with others is terrifying. And Tom really gifted me with, right, like he stuck around and he didn't abandon me. He was willing to work on the process with me, get himself some support, have his own boundaries. And he really showed me and modeled for me that, connection is so important. So he was that first really stable foundation of attachment alongside, my therapist. And then being able to have other healthy attachments. And now so more from the language of, and they all respect it. So whether it's Powerhouse Women, An Infinite Mind, or Mom Army, or Badass Do-Gooders, I'm able to say, I will plug in where I can. There may or may not be times I can or cannot show up depending on what's going on with the parts. And everybody in those organizations has been super welcoming and accepting of that with me. And nobody tries to push my boundaries there. And I've developed some really divine friendships through those communities. And I'm so grateful. And many of those, actually every single person that I just named as those founders has been willing to learn and educate themselves about DID so that they can be in connection with me. And I don't have to explain anything. They're learning and they ask appropriate questions and don't cross my boundaries. And they're also patient with the fact that it takes my parts a while to build trust. So I just really encourage people to have a willingness to step outside their comfort zone, to put themselves in different communities and to try them, knowing that they may not all be the right fit, but to keep trying because you will find your tribe of people. And we really need connection, community to thrive. And without that, we're not going to thrive. We might just keep surviving and going through the hamster wheel. So leaning on others and asking for support is like my number one message of hope.
Yeah. Well, that's such an important message and such a great place to end the episode with is just keep taking those steps towards others who are safe, who you can trust, to build that community, because there's way too much disconnection these days, and it takes a lot of courage to develop intimate connections with people, but it's so worth it and so important for our wellness.
Yeah. And I didn't want to move over to, I did want to make sure I mentioned this because a lot of the communities, because I'm a female entrepreneur, I'm involved in a lot of women's groups and things like that, but Badass Do-Gooders is open to both men and women. And I have a really, really good male friend with DID named Larry Rule. He's been on my podcast. I met him through An Infinite Mind. And sometimes people will make this assumption because I'm a female and I had to endure horrific abuse by my father, that I don't like men, which is not true. Your father, one of my mentors, Dr. Marcus Earl, Larry Rule, Tom, my friend Vane, being able to, have a really good balance of both men and women in my life. I just want to make that clear to the audience that, I'm not a survivor that's just angry and hateful with men. I appreciate and respect men just as much as I do women.
Oh, that's great. Well, thank you two so much for being on the podcast today, and have a great rest of your day.
Thanks. You too.
Please press the subscribe button, as well as rating and reviewing our podcast. This helps others connect with what you've been hearing. If you have any questions, please contact us at themindofatherapist@gmail.com. These questions will be kept anonymous. I want to thank Eric Price for the wonderful music you hear in this podcast. Additionally, this podcast was created to provide accurate and authoritative information on the subject matter. Although we are interviewing licensed therapists, they are not your therapists. This podcast is not intended to serve as direct medical advice and should not be used as a substitute for direct professional help. It is given with the understanding that neither the host, publisher, guests, or PCS are rendering legal, clinical, or other professional information. If you need a professional, we encourage you to find one. Visit Psychology Today to connect with a licensed clinician near you.